Welcome everyone again to the University of New Mexico Law and Mental Health series, weekly discussions of practice and science by experts in behavioral health and the law, hosted by the University of New Mexico Department of Psychiatry and Behavioral Sciences, along with the New Mexico Behavioral Health Services Division. I'm Anthony Perillo, the Forensic Psychology Training Director in the Division of Forensic Behavioral Sciences here at the University of New Mexico. For our presenter today, if you have any questions for her, make sure you enter those in the Q&A box, not the chat box, the Q&A box, whenever you feel comfortable. We do hold those questions till the end. We do try to get to as many as we can, but just sometimes we're not able to get to all of them. Forgive us if we don't get to yours. If you are pursuing continuing medical education credits, there will be a sign-in sheet that will be posted in the chat box shortly. If you are pursuing APA continuing education credits, a link for that will also be posted in the chat box, but in the later portions of the hour. Make sure you keep an eye on the chat box then for that. Check the link, make sure it works for you. If it doesn't, save it on the sides. It will work later on. And make sure you save your certificate after you complete the survey because we don't have access to those after the fact. A recording link and PowerPoint slides for this talk should be available sometime this week. And as a heads up for next week's talk in the series, we have Dr. Randy Otto, who will be discussing the use of social media data when conducting a forensic mental health evaluation. But let's recircle and get back to this week. I'm thrilled to introduce you to today's speaker, who will be discussing some hot off the presses results of her work looking at risk for repeated perpetration of domestic violence. This is the one, the only, Dr. Maaike Helmus. Dr. Maaike Helmus is an assistant professor in criminology at Simon Fraser University in Vancouver, British Columbia, Canada. She's also the vice president of research for the nonprofit organization SAARNA, the Society for the Advancement of Actual Risk Needs Assessment. Her research has been focused on offender risk assessment, particularly related to risk scale development and validation, including subgroups such as sex offending, interpartner violence, and Indigenous offending. Also research in the areas of risk communication and biases in decision-making. If you have done any kind of sexual risk assessment work, you have seen her name attached to it. She is part of the development team for the Static 99R, the Static 2002R, the BAR 2002R, the Stable 2007, the Acute 2007, the VRAG-R, the CPORT, the Risk for Admitted Segregation tool. Her name is on a bunch of these tools for her contributions in the area of risk assessment. Dr. Helmus has also had a particular need and interest in meta-analysis and statistical approaches to prediction. She's the co-editor of the Journal of Sexual Offending Theory, Research, and Prevention, and on the editorial board of Sexual Abuse. A formal Banting scholar, she's also won numerous honors, including the Saleem Shah Early Career Award from the American Psychology Law Society and the American Academy of Forensic Psychology, along with the Early Career Research Award from the Association for the Treatment and Prevention of Sexual Abuse and the Governor General's Gold Medal. She is also a phenomenal acronym label person for a lot of these things to keep people interested in the type of work that she does and the work that we do in forensic psychology, I'll say. Dr. Helmus, Maaike, on behalf of the University of New Mexico, thank you so much for rejoining our series and sharing this cutting edge work and your expertise with us. I will go ahead and throw it over to you.
Thank you so much, Anthony. I'm happy to be here, and I'm really grateful that your introduction covered the most important details about me, which is my skills with acronyms. Did you look ahead at this presentation? Because I may have outdone myself here.
I did not go ahead and spoil that one.
Okay. Well, stay tuned. Very proud of myself for today's acronym. So today I'm going to be talking about a new meta-analysis that we have just finished working on. This is the first time I'm presenting the full results from the whole project. I've presented snippets of it from the first half of studies we've coded at a few small presentations, but this is my trial run of the full project, which means I just finished making tables and putting them in slides late last week. And have no concept of how long this will take to talk about. Don't worry, I do know how to read clocks as long as they're working. So I might speed up or slow down depending on how we're doing. I can't decide if I am proud or ashamed to admit that we've been working on this meta-analysis for 8 years now. So I'm very happy to finally be sharing it with an audience. Okay, the University of New Mexico included some a template with information that had to be on my slides. So we'll cover some of that. I have added, as a bit of an introduction, I'm joining you here from the city of Vancouver, which rests on the traditional and unceded territories of the Squamish, the Tsleil-Waututh, and the Musqueam nations. If you're not sure where you live, which were the Indigenous nations that originally were on the land, you can look that up in most parts of the world at the website nativeland.ca. Also, assuming that the information I found on the internet is correct, the University of New Mexico, which is hosting this event, rests on the traditional homelands of the Pueblo of Sandia and the original peoples of New Mexico, Pueblo, Navajo, and Apache were on the land since time immemorial. And so I'd like to acknowledge the land of the institution hosting this event. Here's some information about CEs. Some disclosures. This particular presentation, I don't have any conflicts of interests or financial affiliations related to any of the material, unfortunately. These are views of myself and my co-authors, not necessarily the University of New Mexico. What we're going to talk about today, some of the learning objectives, is that I hope you will better understand how to interpret the results of a meta-analysis. And that from this meta-analysis, you can identify the most empirically supported risk factors for domestic violence recidivism, and also identify some risk factors that maybe people have thought were empirically supported, but are not actually showing up very strongly in the literature. So those are some take homes. The University of New Mexico also asked me to include a slide on cultural considerations, and I love being asked to include this up front. This particular meta-analysis, I'm not presenting anything separated by race, ethnicity, or culture. We'll talk about this a bit more, but this is more of a breadth meta-analysis than a depth meta-analysis. So we're combining together samples from all sorts of diverse groups. We do know that particularly Black people and Indigenous people are overrepresented in many criminal justice systems, and this would be the case in our meta-analysis. But this one does not explore kind of disparate predictive accuracy across different racial or ethnic groups. If that is something you are interested in, I would like to flag that Mark Olver, myself, and other colleagues just published a meta-analysis in Psychological Bulletin that looks at all of the research we're aware of on the predictive accuracy of risk factors and risk assessment scales for Indigenous offenders, all types of offenders, not just domestic violence. This should appear in online first any day now. The page proofs have been finalized. It is a hefty meta-analysis. It's 67 PDF pages of this journal that we've been working on for a long time. So if you want to know more about cultural considerations and risk assessment generally for Indigenous people, you may want to check that out. I would also like to acknowledge my co-authors on this meta-analysis as we suffered together in trying to complete this project. I'd like to acknowledge Bronwyn Purley Robertson, who is very close to completing her PhD at Carleton University in Ottawa. She has been working with me on this for 8 years, doing all the organizing, the coordinating, and probably having more meetings with me than at this point nearly any human being has had. So we've spent a lot of time working on this. We invited Zoe Hilton into the meta-analysis, largely as a consultant and for her conceptual input and content expertise. Zoe, I would argue, is one of the world's kind of foremost experts on risk assessment for domestic violence. And so she's helped us with a lot of organizing and categorizing the risk factors and domains and contextualizing it within the domestic violence literature, as I've spent some time in that field, but have spent more of my research time looking at sexual offending. Okay, so a little bit of context. What we know in the general literature is that for interventions that are intended to reduce recidivism, whether it's treatment or any criminal justice sanction or anything like that, for interventions to reduce recidivism, meta-analyses from decades have found that they're most effective when they follow 3 principles: the risk, need, and responsivity principle, often referred to as the R&R model. The full model has more than 3 principles, but these are the core ones. And one is that any intervention should be proportionate to an individual's risk to reoffend. Higher risk offenders need more intensive treatment and supervision and monitoring. And that treatment, supervision, and monitoring should be targeted towards criminogenic needs. In other words, things that actually predict recidivism. targeting things that are not related to recidivism isn't going to be as effective. And the third principle is responsivity, that what we do should in some way be matched to the individual needs of the person we're working with, or what we know in general from research about offenders. So that might consider motivation level, culture, learning difficulties, any of those sorts of things. And so to actually reduce recidivism following these principles, risk assessment is inherent in 2 out of the 3 principles. To apportion resources and to know what to target, we need to know what predicts recidivism. Now, many of you may be familiar with this, but I want to briefly highlight that a key framework for what predicts recidivism was offered by a group of Canadian forensic psychologists, first introduced in 1990, and summarizing decades of research on crime at that point. This was largely work done by Don Andrews and Jim Bonta, but they had a team of other key researchers involved, Steve Wormuth, Paul Gendreau, and they organized the literature and identified the central 8 risk factors that seem to predict crime and reoffending. And those are listed here, and we're going to talk about them further. So this was outlined over 30 years ago. It has shaped the field of general risk assessment since then. And in meta-analyses, since they came out with this, they've found that these central 8 risk factors apply to youth and adults, to men and women. They're pretty broad. And so I would argue that this is essentially the model to beat. Whether we need specialized risk assessment scales for a specific type of offender depends on whether there actually are specialized risk factors beyond the central 8. The area I come from, which is mostly sexual recidivism risk assessment, there's been a huge body of research on this. It's probably one of the most active subfields of risk assessment research. And general conclusions there is that predicting sexual recidivism follows the same rules of improv comedy. Yes, and. All of the central 8 risk factors apply, and there's a bunch of unique risk factors for sexual recidivism. And optimal risk assessment for sexual recidivism is a combination of the central 8 and the specialized. They both predict incrementally. So this, I think, generally is a starting point framework that we should use in thinking about risk assessment. I'm also going to say, as Anthony noted, feel free to put your questions in the Q&A, not the chat box as we go. I'm not going to look at them as we're talking because that's going to distract me. So I'm going to assume if there's any tech issues, like my audio cuts out or freezes or you all disappear, Anthony will unmute and tell me. Otherwise, I assume all is good. So the question is, do we need specialized risk tools for domestic violence? And that does depend on, are there specialized risk factors, or is the central 8 all we need? Now, the sexual recidivism field that I've spent a lot of time with is quite unique because I would say in that field, people have strong emotional reactions to the offense that tends to cloud their ability to make evidence-based decisions. The domestic violence field is interesting in a different way. Historically, and kind of broad characterizations, if you look at it, I think it's been more than other fields, much more ideologically driven in a way that has kind of led to a tunnel vision and how research has been done and interpreted. And the strong ideological focus in the domestic violence field has been interpreting it as gender-based violence rooted in patriarchy. And I think there's absolutely some truth to that, but it's a lot more complicated and nuanced than that. I can't tell you in this meta-analysis how many studies we came across where they literally in their methods section said we were interested in studying domestic violence. So we looked at everybody who was convicted of domestic violence. 20% of them were women, so we excluded them from the sample. And no explanation given for that. It's just obviously in their framework, they assume that any woman who commits this is just an aberration or an error, even if they're 20%, 30% of the sample, and everything is just viewed within the lens of male on female violence, which again is a common pattern, but by no means the only pattern. And so I think this is a field where a bunch of specialized risk assessment tools for domestic violence recidivism were developed, starting with the premise that yes, we do need specialized risk tools, and there's something very unique about domestic violence offending, and they focused quite narrowly on that. So I've listed out some examples of specialized domestic violence risk tools that have been developed over time. Okay, and then this is going back to a bit of a deep dive. It's getting a little bit dated, but way back when I was an undergraduate student in university, I did a field placement at Public Safety Canada, and the research project we worked on was a meta-analysis of how risk assessment scales predicted domestic violence recidivism. And there weren't a lot of studies at the time. There's been much more since then, but this meta-analysis I still have handy. And what we found is that the predictive accuracy of risk scales developed specifically for domestic violence in predicting domestic violence recidivism, they had moderate accuracy, actually a bit less than moderate. The average Cohen's d was about 0.40. And scales that were designed for other outcomes, kind of generic risk assessment scales, there were fewer of those studies, but on average, they actually predicted better. So most of the time, something developed uniquely for a subgroup should predict better than generic tools. But we weren't seeing that in this analysis. The results of the domestic violence risk tools were quite underwhelming. And if you compare it to other fields, general offender risk assessment, sexual recidivism risk assessment, it varies, but you tend to see Cohen's D's that tend to be almost twice as high as this. So the predictive accuracy in this area just wasn't doing as well. And it's, definitely made me wonder over the years, and every time I dabble in this field, about whether we have a really good empirical basis for knowing what the strongest individual risk factors are for domestic violence recidivism. Because a risk tool is only as good as the research support behind the individual items. So I wanted to meta-analyze risk factors for domestic violence recidivism. As Anthony alluded, I do like to give acronyms to my research projects. If you're going to spend that much time with something, you want to name it. I do not have children, so I name my research projects. And I'm really pleased with this one. We called this project VIPER, which just sounds badass, right? And it stands for Violence Against Intimate Partners, Estimating Recidivism. I'm really proud of this acronym. So the inclusion criteria for this meta-analysis was any sample of adults or adolescents, although they were almost all adults, who had committed intimate partner violence or domestic violence offenses. Now, I will point out intimate partner violence is obviously committed against an intimate partner. Domestic violence is a little bit broader, and research has changed over time in terminology and definitions. Domestic violence samples tend to include primarily intimate partner violence offenders, but generally have some subset of people who might have committed offenses against other members of their family, their parents, their children, their siblings, because so much of the research is not distinguishing between those, we would lose so much data if we excluded them. So this is kind of broad and noisy that this is summarizing domestic violence, which would be mostly IPV, but there is a little bit of other stuff in there. They had to have follow-up data on recidivism, and recidivism measured in some way as yes or no. The recidivism had to be committed by the same offender. This field has a lot of research studies using victim data and following up the same victim at multiple time points. And there's lots of studies that assess if the victim has been re-abused, but unless they specify that they were re-abused by the same partner as the first time, we had to exclude those studies. Because we're trying to focus on on how to predict whether a person will re-offend, not whether a victim might become a victim again in a subsequent relationship. The studies had to include a recidivism outcome in one of the following categories: domestic violence recidivism, that was the main one, that's the only one I'm going to present today, violent recidivism, any recidivism, or technical violations. Now, domestic violence recidivism, most of the time it was kind of any recidivism for domestic violence, but some studies looked only at physical domestic violence or severe domestic violence, or some studies even attempted intimate partner homicide. So we were pretty inclusive. We wanted to be as comprehensive as possible. So we were pretty inclusive in what was meant by domestic violence recidivism, but for the statistics we're using, it had to be, there had to be data on yes, no, not just the number of times they committed recidivism. There had to be enough information to calculate our effect size, which was Cohen's D. A big thing in this meta-analysis is that it had to be a bivariate relationship reported. So that means the relationship between one predictor and recidivism. Lots of studies did complicated multivariate analyses looking at how predictors might have predicted recidivism after controlling for a whole bunch of other things. But you can't really meta-analyze that because you can't interpret it if they're all looking at the incremental effect of a risk factor after controlling for different sets of things. You're kind of comparing apples and oranges too much. So we needed data on a bivariate relationship, one predictor, how it was related to recidivism. And we had some sample size requirements for statistical purposes. I'm not going to go into detail on the search terms. It's important to have a comprehensive search for a meta-analysis, and we compiled and refined this over time. By we, I mean mostly Bronwyn, and did searches kind of broadly for anything on intimate partner violence. And as we identified what tools were out there, we also did targeted searches on any studies looking at those tools in case they might report other predictors or the individual items in those tools. At the end of 2022, Bronwyn found 123 non-overlapping studies. Now, it's very common in the research field that data sets can yield numerous publications. Here, there probably were over 200 documents and studies that we found. But once we grouped together in the same project, everything that came from the same sample, it was 123 kind of non-overlapping projects or samples. Our coding manual of what risk factors we were considering continually evolved over time as we came across new complicated situations, made decisions, recorded them so we could apply it consistently going forward. And as we came across new predictors we hadn't imagined and figured out how to capture it. Almost all of the studies involved calculations going from the data presented in the study to calculating a Cohen's d. There's different ways of doing a meta-analysis. A lot of people for efficiency do inter-rater reliability and then one person codes, or teams code just one study, or one study is coded by one rater. I find meta-analyses are actually a lot more complicated than people think in getting all the correct information and double checking everything. And so the way I was trained in meta-analysis, that's very time intensive, but I think is the best way to do it, is absolutely every study and every number and effect size was double coded by both Bronwyn and I, and then we would meet and develop a consensus rating. And every difference down to the third decimal point, we would meet and go through where we got our data, how we did our calculations until we were both on the same page in agreement with every single number. And then verified that it was all entered correctly. So over the past 8 years, we would take breaks here and there as certain other deadlines kind of impeded. But I would say at least half the time over the 8 years, our kind of schedule and routine is that we'd each individually spend a few hours every week coding studies. And then Bronwyn would enter the data, and then I would look at the data set and compare my rating to what she entered, highlight every single discrepancy, and then we'd meet on Zoom every week, usually for 2 to 3 hours, and we would go over every single discrepancy and develop a consensus rating. She would update it, and then I would double check in the data set that the updated data matched my records of our final decision. So this took a long time. I will be totally honest. If I could go back in time and I knew how much work this meta-analysis would be, I wouldn't do it. But I'm stubborn enough that after I got a couple of years in, I figured I might as well finish it. Inter-rater reliability analyses, we did do that early on, and I just haven't finished entering it and analyzing it. I think it'll be good, maybe not outstanding. But I think the key thing either way is that we didn't do inter-rater and then one person coded everything. Every single thing at the end of the day was a joint decision. Also, if you're running a lot of meta-analyses, it's difficult to identify outliers. The concept of an outlier is an unusual finding that including it or excluding it meaningfully changes the results. That's actually fairly subjective. There's not, in the meta-analysis literature, there's not clear guidelines out there for what should be an outlier. My mentor, Carl Hansen, in doing many of his meta-analyses, developed his own heuristics, and that's now been applied by many people in the forensic psych field. So I use the same criteria that you use to identify when a study is an outlier. Sorry, I'm trying to advance my slides, but it is freezing cold in my office, and my fingers are numb. Okay. So what I'm going to present today is, of all the studies we found, 105 of them looked at domestic violence recidivism, and many studies looked at lots of predictor variables, and we coded them at different levels of specificity. And at the end of the day, there's over 2,500 effect sizes for domestic violence recidivism. As a brief visual of how we coded all of this, is we coded very specific items and variables when we could, because we didn't know what we were going to end up with, how many studies there'd be, and what distinctions might be important. So there might have been kind of different ways of measuring something. Sometimes we averaged them together, but we did code a lot of distinct variables. And then we did categories and super categories to keep grouping things at higher levels. So for example, if we're looking at criminal history variables as predicting recidivism, you might look at criminal history as, prior charges or convictions for domestic violence, prior charges or convictions for any type of offense. If you're looking at prior history of domestic violence, it might be, have they ever had a prior domestic violence, or how many times have they had priors? And it could be that one of those is a stronger predictor than the other. So we coded the individual variables of the number of priors, any prior. Then in analyzing, we would group them together in prior domestic violence, and then we might have done the same thing for any recidivism, and then criminal history as a super category is averaging all of the subsumed categories together. Now, in meta-analysis, kind of the key thing is that for any given variable you're analyzing, it assumes that all of your effect sizes are from different samples. So for any variable or category or super category, if one study had multiple effect sizes assessing the same thing, we averaged them together at that level. So any given analysis at any level, each sample is contributing only one data point, even if the variables within that data point are averaging a bunch of things. And sometimes we coded variables that might have been protective in their direction. And then when we organized and averaged it into categories, we flipped the direction so that it would all be obviously in the same direction. Okay, and also looking at so many different variables, how do we decide what's a useful risk factor or not? It can get very subjective. And so from the sexual violence risk assessment field, I love the conceptualization from the late great Ruth Mann and her colleagues in 2010. They organized sexual recidivism risk factors under a few different categories, and they defined something as an empirically supported risk factor if there's at least 3 studies looking at it. And to make things manageable, we only really analyzed, with some exceptions, variables and categories that had at least 3 studies available. So it needs to be at least 3 studies. The effect size has to be statistically significant. And how big does an effect size have to be to call it, a risk factor? They recommended a Cohen's d of 0.15 or greater. And the reason is that that roughly corresponds to an absolute increase in recidivism rates of about 5%. So the group with the risk factor might have 25% chance of recidivism, without the risk factor 20. And they argued that that was kind of a minimum enough difference that this variable would be worth assessing in the criminal justice system, and if it's changeable, worth targeting in treatment. So that's kind of worth paying attention to. They also had a definition of what were not risk factors. And sometimes there might not be enough studies or statistical power to find significance. But they basically said we can kind of confidently conclude that something is not a risk factor if there's on average little to no relationship with recidivism, there's at least 5 studies available on it, and not just the average effect size, but the upper limit of the confidence interval doesn't reach that 0.15. So we know with enough studies and fairly high confidence that it wouldn't have an effect size of 0.15 or above. Just going to briefly say there's 2 different types of meta-analyses, largely breadth and depth. Breadth is big picture looking at a field, depth is zeroing in on a variable or a construct, and you can look at things in more detail. They're both useful for different purposes. This is very much a breadth meta-analysis. Apologies if you don't like statistics, but the results are showing a lot of numbers, so I want to just briefly walk through so we can understand what these numbers are telling us. The average Cohen's d in meta-analysis can be calculated 2 different ways, with a fixed effect model and a random effects model. I love talking about the statistical differences, but I'm not going to. Basically, the fixed effect model, the confidence intervals get kind of unrealistically narrow, and the more variability there is in results across studies, the more the confidence intervals are a bit unrealistic, and it can be too strongly influenced by studies with large sample sizes. The random effects models, for a variety of reasons, conceptually is almost always the most appropriate approach. It's what you want to look at generalizability. However, the big limitation is that when you have less than 30 studies, which most of our individual variables do, the way the random effects model is calculated actually isn't very stable. So conceptually, it's what we want, but practically, it can bounce around a lot. It does tend to get more conservative, so it's harder to find statistical significance usually this way. And the limitation of it is that, especially when there's a lot of variability across studies, which we often have here, very small studies can have a very strong impact on the findings, and that's usually not something we want. So they each have their strengths and weaknesses, so I report both. K tells you the number of studies that were available on that variable, and N tells you the number of offenders across all of those studies that were included. And then we also have a statistic that tells us how much variability there was in the results across studies. So how consistent were the findings? And it's a percentage of how much of the variability is more than we would expect. And basically heuristics in the field is that 25%, 50%, and 75% reflect small, moderate, and large amounts of variability respectively. So that's a crash course on how to read a meta-analysis. As a quick plug, if you want me to elaborate on that for 3 hours with lots of examples and pictures, Kelly Beth-Shishin and I are doing that workshop through ATSA at the end of February. How to read this meta-analysis, the way I'm presenting the results, so there's not too many numbers. Instead of showing the confidence intervals, I'm using an asterisk to denote p less than 0.05. And there's so much data, so to help you get a sense of it, I try to use color coding. Green tells you it meets the definition of an empirically supported risk factor according to Mann et al. 2010 in both the fixed effect and the random effects model. Yellow means it was empirically supported in one of fixed effect or random effects, but not both. Blue, I've highlighted sometimes as something unusual or weird that I want to mention, and the initials RO stands for the results removing an outlier. It's customary to report results both with and without the outliers, so I do that, but I primarily color code and draw conclusions with outliers removed. Oh my goodness, that's a lot of preamble. I'm sorry, I hope you're still with me. I'm actually going to skip over that. That's kind of a side note. So let's start looking at what the results were. And I'm going to organize it through all sorts of domains, demographic, offense variables, the central 8, mental health variables, the domestic violence specific domains. There's a lot to go through. It took us 8 years to do this project. I'm at least pretty confident it will take less than 8 years to explain it. That I know. Okay, so these are some demographic factors. Age, we know, is generally one of the most well-supported risk factors for crime. And it's a negative relationship, we know, as age increases, recidivism decreases. And it was statistically significant. And you can see here, there were 33 studies. There's a lot of studies that looked at age. And it is a significant risk factor, but surprisingly, it wasn't big enough to be considered empirically supported with that minimum threshold from Mann et al. So it is a risk factor, but it was smaller than I was expecting. Being male was an empirically supported risk factor. So again, green means go, fully meets the definition of empirically supported risk factors. So the 23 samples that included both male and female offenders and looked at recidivism rate differences between them, the men were significantly more likely to reoffend. Cognitive deficits looked at variables of IQ, diagnoses of intellectual disability, or learning disabilities, and that was also an empirically supported risk factor. A lot of literature in the domestic violence field has focused on the characteristics of the index offense, so the most recent offense that resulted in the charge or conviction or brought the person to the police or the criminal justice system. And one of the things that's often talked about is how severe was the index offense. And that was not empirically supported as a risk factor. Now, I'm going to highlight here in terms of the levels of specificity of variables, where you have in the second row, medical care is indented and there's a dash. That means that it's a lower level of specificity. It's included and averaged in severity. So more broadly looking at severity, not an empirically supported risk factor. But there were 3 studies specifically looking at whether the victim, it was severe enough that the victim required medical attention. And that criteria threshold was an empirically supported risk factor. Whether substances were used specifically at the time of the index offense on average didn't come out. At deeper levels of specificity, if we could specify whether it was alcohol involved at index or drugs, it was the involvement in drugs that had a bigger effect. And it met the definition of empirically supported risk factor for fixed effect, but not for random effects. It was a large effect, but it didn't reach statistical significance in the random effects. Other characteristics of the index offense, or really good empirically supported risk factors, were whether the index offense also involved a technical breach, like a breach of probation, and more specifically, if it included a violation of a no contact order. So if the index offense was already reflecting that they had a no contact order in place that they were violating, that was an empirically supported risk factor. Whether the index included threats or unlawful confinement didn't meet that definition. In blue, this was a bit unexpected. A lot of people have thought that if the index offense also included sexual violence against the victim, that would be higher risk. It wasn't generally significant, and if anything, it was in the negative direction, that those committing sex offenses as part of the domestic violence were a bit less likely to reoffend. Holy shit, I thought an hour was going to be tons of time to talk about this, and it is not. So I'm going to go through a few things a bit more quickly. Consequences, I'm not going to talk about that. So let's organize things on the central 8 risk factors. And I kind of call the slide, what would Jim and Dawn say? So looking at the central 8 risk factors, here they are repeated. Criminal history. Oh my goodness, that is so much green. I get it. Best predictor of future behavior is past behavior. Now here, I'm going to highlight if something is bold and underlined, that means it's a super category. So there's several levels of specificity underneath it. So the whole domain of criminal history, large effect sizes. And in fact, some of these effect sizes on average are about the same level or higher than entire domestic violence risk scales. And it doesn't matter how you slice it, any prior offense, a prior domestic violence offense, any type of violent offense, having offenses for violating prior no contact conditions or violations of conditional release. All of these were strong. Prior offenses for substance abuse, prior violence that excludes intimate partners, prior violence that excludes, or prior offenses that exclude intimate partners altogether. If they have a prior sentence in custody, general scales assessing criminal history, all looking very good. The one that didn't pan out is prior juvenile offenses, and age at onset didn't quite meet our criteria of empirically supported risk factors. The next central 8 is antisocial personality pattern. So as a broad domain and category, this one came out really strong. The effect sizes on average were almost double the minimum criteria to be empirically supported. And on this slide, kind of one category was broad conceptualizations of antisocial personality disorder or psychopathy, and whether it was psychopathy measured with the PCLR, another type of measure of psychopathy, a diagnosis or scale assessing antisocial personality disorder, conduct disorder, oppositional defiant, all looking really good. If we drill down into specific traits of antisocial personality pattern, narcissism, impulsivity, empirically supported, hostility, you would expect would have been, particularly for intimate partner violence, but it wasn't. And the SAARNA has a particular item for any personality disorder with anger, impulsivity, or behavioral instability. It was an empirically supported risk factor in the fixed effect, but it wasn't quite significant in the random effects. Antisocial cognitions, attitudes, as a category and domain, this worked well. And we looked at it at different levels, kind of general attitudes supportive of crime and general externalizing and placing responsibility on others, as well as attitudes specifically supporting intimate partner violence. All looked good. What about denial and minimization of offense? This is a slightly different construct, and decades of research on sexual recidivism risk assessment finds that denying the offense isn't actually a risk factor. In fact, in some cases, it might be a protective factor. The idea is people who deny doing it, in some way, they're agreeing, yeah, that's a shitty thing to do, and they don't want to admit that they've done it. In contrast, attitudes tolerant of offending is an empirically supported risk factor. And the distinction there is, attitudes that, distance yourself from having done the thing versus attitudes that are saying, you know what, sometimes it's actually justified to do that thing. And so I thought in domestic violence, we would see the same pattern. Denial and minimization, not so much a risk factor, but attitudes supportive of interpartner violence would be. On this one, I will gladly eat my humble pie. Denial and minimization as a broad category was an empirically supported risk factor. Shows remorse in particular was. Maybe that's a bit mixed up with kind of psychopathy types of characteristics, but that came out strongly. Denial on its own, there were only 2 studies, that's why it's highlighted in blue. And it was a bit protective that people who just flat out denied it were in the direction of less likely to reoffend. But the category together, all of denial minimization was a risk factor. And a shout out to the SAARNA item. It has an item for extreme minimization and denial of the offenses. And I was always skeptical of that item, but you know what? It works good. Antisocial associates. Now, originally I assumed obviously there's a protective part of this. You might have negative influences, but you might also have positive influences. And it's not quite the same thing. You can have both in your life. So we separated bad peers from kind of positive social supports. On average, didn't predict. But if we focus just on the bad peers, that was empirically supported. And then I guess if you look at the name of the central 8 domain, it doesn't say quality of social supports. It specifically says antisocial. So maybe we broadened that too much. If we use Andrews and Bonta's definition, it was an empirically supported risk factor. Family and marital types of variables. As a domain, not quite high enough effect. This is a bit cheating though. Everything that was specific to their relationship with their intimate partner that they may have offended against, we moved that in a separate section. So this is kind of residual family marital, looking at things related to their childhood and family of origin. And there were some empirically supported risk factors there. School and employment, on average, empirically supported risk factors. Work-related variables were stronger, and that makes sense because that might be more recent current information, whereas school might be more historical. In terms of the education, breaking it down, it was not completing high school that was an empirically supported risk factor. Risk factors that looked overall at the level of education didn't pan out. So this might be kind of a threshold thing that once you have high school education, the amount of education after that doesn't really matter. It's that high school threshold that's important. Poor use of leisure recreation time is one of the central 8 risk factors. We found, I think, only 1 study that looked at it. Substance abuse, came out clearly as empirically supported risk factor. We had different levels of specificity where we could to specify alcohol and drugs separately or generically if they combined them both and didn't disentangle them. Current, past, we tried to separate where we could, and we also tried to separate marijuana misuse because I thought that would be very different from the effects of other drugs. That was empirically supported too. That was also a surprise to me. And a shout out, the ODERA has an item on more than 1 indicator of substance abuse, and that specific item was actually the strongest in this category. So recap of the central 8, generally looking really good. And even the antisocial peers, if we actually restrict it to just antisocial peers, yep, it meets that definition. Family marital, again, I excluded a lot of stuff from here to talk about separately, so there is a lot in here that does predict. Overall, if we ask what would Jim and Dawn say, I think they'd say the central 8 are universal. What about other domains? Financial and accommodation is often in the general offending literature considered kind of a minor risk factor. It's there, but not one of the central ones. That's largely what we found. It was a decimal dust away from being empirically supported risk factor. Weapons related variables. There's a lot of emphasis in the domestic violence field on whether the offender used a weapon in their most recent offense, if they have access to weapons, and several risk scales have weapons-related items. This domain, nothing on average did not predict recidivism. Whether they had access to weapons or like special military training with weapons, did not predict. If they used a weapon in the most recent offense, did not predict. That was a predictor if they have ever in their criminal history used a weapon, or ever in their domestic violence history. That came out, but on average, not really a lot going on here. What about mental health? They did a whole talk on the relationship between mental health and crime. It's complicated. In the Central 8, it's often considered the vague kind of psychological distress might be a responsivity factor, but generally not considered particularly criminogenic. We did find on average, the domain of mental health problems was empirically supported. It kind of not as big as a lot of the other ones, but it's there, it meets it. Weirdly, if we tried to distinguish, it was prior mental health problems, ever had a mental health problem, was a better predictor than their current mental health. And then drilling into some of the specifics, suicidality was one that we struggled with because in the mental health literature, it's a symptom of depression. And so depression, anxiety, and suicidality tend to be related. But in patterns of domestic violence, suicidal often is in the context of the person threatening suicide as a manipulation and control tactic. It's part of the pattern of psychological abuse. And we tried to separate that out of variables that looked at being suicidal as a mental health issue versus using threats of suicide. And basically take home here is that anything related to suicidal, we tried to distinguish mental health or threats, but it all tended to predict recidivism. And suicidal kind of brought the category of depression, anxiety, suicidal into an empirically supported risk factor. But if you try to separate out depression and anxiety, those don't seem to be relevant. It is the suicidal that seems to be relevant. And I'm not sure that we can disentangle what's actively, genuinely suicidal as a sign of depression versus part of an abuse pattern. Borderline personality characteristics, again, decimal dust from being a reported empirically supported risk factor, not surprising. Diagnoses or symptoms of psychosis, not empirically supported risk factor. Interestingly, motivation came out as an empirically supported risk factor in the direction of people rated as higher motivation were more likely to reoffend. Totally unexpected. I'm not going to talk too much about the treatment-related variables, except having dropped out of treatment came out really strongly. This is consistent with other areas and is probably more of a reflection of antisocial personality pattern of who doesn't stick with treatment. Domains that have been considered fairly unique to domestic violence, victim vulnerability factors. I haven't seen any other risk assessment field that codes a lot of information about the victims, but this one does. With the idea that more vulnerable victims are more likely to be re-abused by the same person. A lot of the victim vulnerability factors were not empirically supported risk factors, but if the victim had substance abuse issues, that was. If they had a prior history in childhood or previous relationships of being abused, if they were currently pregnant at the time of the index offense or at the time of the assessment, that was close to being an empirically supported risk factor. Relationship variables. Relationship stability, we looked at in terms of like the investment in the relationship, whether they were legally married or how long they'd been together. Those were in the pattern of lower recidivism rates. Relationship quality is more about how problematic and conflicted. Sometimes it was specific variables like has there been infidelity, but when we had the variable of just general ratings of conflict in the relationships, that was an empirically supported risk factor. The perpetrator being controlling was significant, but not large enough to be empirically supported. This is something there's been a lot of literature lately talking about coercive control as a key dynamic, and it was there, but not strong. Recent separation was unexpected. A lot of people talk about the recent separation being the highest risk period. It didn't come out. We talked a lot about early on about the most recent offense that led to their involvement in the criminal justice system. There were not a lot of empirically supported risk factors there, but variables that looked at the whole pattern of domestic violence with this particular relationship. So not the most recent incident, but the pattern in that relationship. There was lots going on there. Specific empirically supported risk factors were escalation, if the offender had ever assaulted a victim while she was pregnant, threats of suicide, dual perpetration is talked about a lot. It wasn't related to recidivism. Choking or strangulation was, sexual abuse ever against the partner was, frequency and severity, psychological abuse was close but not there, and property damage all came out. Risk factors specific to domestic violence. Jealousy came out really strongly. Another one that's been talked about a lot in the literature is harassment and stalking behavior. And there were a bunch of studies on that. And it was significant, but not large enough to be an empirically supported risk factor. There's also a lot of discussion about children, and we looked at that at different levels. Whether the offender had biological children, whether the offender had stepchildren, so it was the victim's children, vague variables that basically said children exist in this relationship, but didn't disentangle whose children were whose, or specifically joint children, that they had biological children together. And it was more the stepchildren or the offender's biological children that seemed to be a risk factor, but not children on average. Okay. I tried to give part of this at a conference and only included some variables. And I'm like, an hour is plenty of time to cover this. Not at all. Lesson learned. Good to know. So what just happened? I showed you so many variables, so many results. That was overwhelming, probably. A highlights reel. I think the biggest, strongest empirically supported risk factors coming out of this is criminal history. So much in there, almost any way you slice it. Antisocial personality pattern, antisocial cognitions, which include general crime supportive, as well as attitudes tolerant of domestic violence, and kind of minimization and denial. Treatment dropout and jealousy, I would say, in the strongest risk factors of what's really specific to IPV, jealousy is the main one that came out. And then there's a whole bunch of other notable empirically supported risk factors, a mix of central 8 and specialized. Some things that were unsupported overall, but interesting exceptions. I've talked about that as we went through. Things that are not a risk factor, strongly there's enough data to conclude with confidence, not related to recidivism, is those being prosecuted versus not. Cohabitation, whether they live together in recent separation. And then I expanded the definition a little bit for some other variables that are looking close to being us confident they're not risk factors. Promising research needed. We had 2 studies and it looked good in 2 studies, but we need more research. I'm just going to highlight criminal versatility. I've said it before, I'll say it again. That item from the PCLR, I think, is one of the most interesting and under-researched risk factors out there. I would love to know more about that construct. I think it's great. Limitations and recommendations. No one's looking at leisure recreation. Researchers, report your bivariate analyses. This is kind of basic foundational stuff. It should always be in there. Data are noisy. There is a lot of variability across this. So this is a breadth meta. We need depth metas looking at some of these in more detail. A comment, this is predicting if they are going to reoffend, not predicting the severity if they do reoffend. Often in other areas of violence, those are quite related, but not necessarily the same. Big picture, overall, I spend all my time research looking at risk assessment, primarily for sex offending, but lots of other outcomes. And I've been dabbling over the past 15 or so years in intimate partner violence here and there. Research, not committing, of course. Big picture recommendations, my overall assessment of the state of the domestic violence risk assessment field is that I do think specialized domestic violence risk scales are out of balance with the research. They tend to include and focus quite heavily on some items that the research just isn't supporting very strongly. They tend to omit some important risk factors. Almost all of the scales do include some central 8 risk factors, but by and large, I would say they underweight the central 8 relative to the scope of them and the importance of them. And they place too much emphasis on what they presume is unique to domestic violence. And in general, there tends to be a heavy focus on features of the index offense, which as a category just wasn't that useful. So thank you, and I'm sorry that that was so much information. Are there questions?
There are definitely in the chat. Thank you so much, Maaike, for that latest and greatest there. A lot of information to chew on, process. A lot of people eager to see the finished product or any places where they can read more of this.
Right now the source is this. We have all the analyses and tables, and again, to try and reduce errors, Bronwyn ran all the analyses, and then we paid a grad student to rerun every analysis and every discrepancy they've been working out. That process is almost wrapped up. But it's going to take a while to write up. It's going to take even longer to publish. This won't be out for a while, but the slides will be shared. You can cite that for now.
Do you plan to present this in other areas?
If I get invited, yes. So I think what I've learned is I can't present this in a 10 to 15 minutes conference presentation. Like that's just not a thing.
Gotcha. Fair enough.
So I need people to invite me to have more time.
Mm-hmm. For those of you that are pursuing the APA continuing education links, that is in the chat box. If you look at the timestamps for 11:54 and 11:55, there are links. Start survey AZ1 Qualtrics. That's the one to pursue there. For questions for Dr. Helmus, feel free to enter any more in the Q&A box. She'll graciously stay on for a couple of minutes to answer some of those. Somebody asked in terms of the outcomes for these meta-analysis, do any of these studies include anything other than overt physical abuse? Is verbal abuse, passive-aggressive forms of abuse included in these outcomes?
So great question, and it varied by studies. And what's interesting in this field is most other fields pretty much only look at criminal records data, but there's a good chunk of these studies that the outcome came from self-report or victim report. And that tends to give much more inclusive definitions of recidivism. And what we tried to do in studies that had multiple outcomes and definitions is we included the most expansive. So if it included undetected offenses, we counted that as recidivism. But we did try to restrict it to behavior that would be illegal. So something that would be a crime. So in the domestic violence field, there is a lot of emphasis on psychological abuse, and it can be very devastating to the victim. But psychological abuse, as shitty as it is not a crime. So we were, based on kind of our work in the criminal justice system, focusing on behavior that would be considered illegal. But within that, we use the broadest, most expansive definition available.
Excellent. Thank you. Let's see. Shanti, we're getting a lot of questions that for some reason people
questions. Oh
well,
my God,
a lot there seems to be a technical issue where a lot of people aren't seeing the CEU link. I'm gonna try to type something in there. We have that message. I will try to type it in there in case for some reason Shanti's isn't showing up for everybody else. I see it, but I will type it in. In the meantime,
yeah, I'm also
what do you think about modeling level of missing data in individual studies in a meta-analysis?
I see that one on there. Great question, Ian McPhail. I'm glad to have you come out. Bronwyn has actually just got accepted for publication with us a separate paper on missing data using the SAARNA and stable. And in a whole risk assessment scale, what we're finding is the risk scales are surprisingly robust to missing data. At this level, I don't know, as we've talked about this before, McPhail, I have data. If you want to play with me, we can talk about it. But yeah, interesting question.
Excellent. In the same matter of the denial variable, did your analysis look at shame at all? Specifically, if someone feels shame about an offense, would they be more or less likely to reoffend?
That is a great question. And I love some of the literature in other areas of psychology about the role of these different types of emotions. And we didn't have that specifically examined, maybe one study, but not enough to meta-analyze. So there were we coded it at a lot of level of specificity. So over time, if more research becomes available, we can add to it. But what we had to do for the analyses was often aggregate specific variables into larger and larger domains and concepts so that we could get enough data together for stronger conclusions. So we don't have that in particular. I see a question from Stephen, who is my student at SFU. Great question. Let's talk about it later when I see you this afternoon.
Any gender differences that you've looked at yet in terms of differences between men and women? Yeah.
Also great question. And those are some of the differences between a breadth meta and a depth meta. There were a bunch of studies that reported effect sizes separately for men and women, and we coded them as two different samples. One of our goals in the next year or two is to do a whole separate study identifying all the studies that did look at differential predictive accuracy between men and women. We're going to have much fewer effect sizes, but it'll be interesting. We can model within the same sample whether the broad domains at least have similar predictive accuracy. That's one of our goals.
Somebody said that quite a project, very interesting. They're asking if they're correct in thinking there isn't an examination yet of incremental prediction. So from a practical perspective, there's probably a lot of overlap in the factors. Is that fair to say?
Yeah, there certainly would be some, and that's in general a great question. I see a lot of people in court reports always say, well, we've used all these risk tools, but they don't consider this one factor. But we do know incrementally, you reach a point of diminishing returns. Once you assess enough risk factors, usually new risk factors don't add that much incremental. That's why most risk assessment scales tend to top out at 10 to 20 items. Usually after that, it's a lot of, it's correlated enough that it's not adding unique information. So they're probably, generally, I think what you need for a good risk tool is a good sampling of items across the Central 8 and domestic violence specific, but at a certain point, you will reach a saturation point. And we can't really meta-analyze that because what's incremental depends on incremental to what, and no studies are looking at the same incremental to. So that's not interpretable as a meta-analysis, but that is kind of a whole separate question for risk scale development.
Gotcha. In terms of moderating variables, are there other ones that you're particularly planning to look at?
We coded so many potential moderators, and there is a lot of variability in our results across studies. So this is something we probably need to look at, like whether it was kind of police contact samples that weren't charged or if the data came from victims. There's all sorts of moderators we want to look at, but the challenge is a meaningful moderator analysis has to be analyzing the same effect size. And so we have to pick a variable that has a lot of studies and then look at moderators for that. And once we do that, there's not really a lot of variables. Criminal history is probably our best bet of something that there's enough studies that we can do meaningful moderator analyses. You'd think in a meta, we have so many studies, there's lots of statistical power, but for moderators, you actually need a ton of studies of the same variable to do well. And that's where I think depth meta-analyses would come into play.
All right. And then one final question here to wrap up. Somebody said, did you look at offenders that commit domestic violence along with other crimes, and which crimes are more commonly seen with individuals committing domestic violence multiple times?
Great question. So that's kind of more descriptive of the samples in their offense history, and we didn't meta-analyze more descriptive variables. Where we did look at it was the different types of criminal history, and we tended to find that criminal history for non-domestic violence offenses was just, on average, just as predictive as prior offenses for domestic violence. So in general, I think what we do see is, a lot of criminal history of any type is more of a risk factor, hence that versatility in offending, which I mentioned as a very under-researched construct. I think versatility in offending behavior is, really promising and needs a lot more investigation. But yeah, we didn't do too much of descriptives of kind of how many had offenses beyond kind of the domestic domain.
Wonderful. Well, thank you so much, Maaike, Dr. Helmus, for a very informative, very helpful presentation. I know a lot of people can't wait to see what comes of this and how we can read further. For those of you that I hope that the link was able to be visible to everybody else. If it's not, my apologies. I will look into the CEU team to see if there are any kind of strategies that we can use to make sure that people get that link. But otherwise, that wraps up this week's Law and Mental Health series. We hope to see you next week when Dr. Randy Otto will be covering the use of social media data during forensic mental health evaluations. Until then, we hope you have a great rest of the week and take care.